Hello and welcome to yet another episode of the Wellness Wave, a podcast series on health and wellness organized by the Department of Media Science, the Heritage Academy. Today we have on board Dr. Utsab, a consultant pathologist and diabetologist who also happens to be a senior resident doctor at the Srirampur Walsh Hospital, West Bengal. Hello, sir. We are extremely honored to
Hello.
have you on board today.
I am also happy to be with you.
Yeah. So since the topic of discussion today is on cervical cancer.
Yes.
So, sir, my first question would be, what is human papilloma virus infection?
Yes, first, why we have chosen this topic? Because this is a very rising topic.
Yeah.
Right now, it is the fourth most common cause of cancer in women, and incidence is steadily rising in many parts of the world. So we have to know about the etiology, the causes.
Right.
So it is a viral infection, but it is mostly transmitted via sexual route. So we have to know what are the precautions we have to take, what are the things we have to think about before being in the lifestyle.
So, sir, can you brief on what is human papilloma virus infection?
Yes. This is an infection that is that, as I said, like it is through the sexual transmission route. So we have to think about firstly about the safe sex. Secondly, about not having too many of multiple sexual partners. These two are the main things to think about.
Okay.
Yeah.
Sir, how is the human papilloma virus related to cervical cancer?
Yes. Actually, it depends on one person's own immunity as well, because in many persons the virus is cleared on itself by the innate immunity system of the body.
Okay.
But if your immunity is not good enough, then it may persist for long and then cause the mutations that can lead to cancer.
Okay, sir. So, what are the early symptoms of cervical cancer?
Yes, we are talking about women's cervical cancer
Right.
from HPV. So, firstly, there is excessive bleeding during intercourse, excessive bleeding in between two menstrual cycles, or excessive bleeding post-menopause.
Okay, sir. Sir, is bleeding the only symptom?
This is the most common, and then people also complain of pain during intercourse. That is also very frequently complained.
Sir, are there any urinary issues related to this?
Sometimes we can see vaginal discharge, which is bloody and watery.
Okay.
Usually.
So, sir, if white discharge in women, can it be a cause of cervical cancer?
Usually, white discharge is for some infective causes, not for this. Actually, the color and the consistency of the vaginal discharge is a very important pointer towards what kind of infection or what kind of problem they are having. So, white discharge we think about usually any fungal infections or other viral infections. In HPV, usually it's watery or bloody.
Okay, sir. So, what are the treatments available for cervical cancer?
First, most important is to have it in the very early stage. So, surgical intervention can save many parts of your cervix, and there are also radiotherapy and chemotherapy available.
Okay, sir. So, apart from that, none.
No, usually this radiotherapy, chemotherapy, medication is very limited.
Okay, sir. Sir, does cervical cancer affect the fertility and pregnancy in
Yes,
women?
definitely. Because if it is detected in the later stage, then we have to do a big amount of surgery. Big part of cervix is taken out. Then obviously there is no question of pregnancy after that. And HPV infection in men also can cause effect in the baby and also the partner.
Okay, sir. So, what are the lifestyle changes that one can follow in order to reduce the risk of cervical cancer?
What I have said already a few points before, and other than that, it is seen that people who smoke, they have relatively lesser innate immunity. So we have to consume, and we have to lessen the amount of smoking. We have to increase our immunity. For that, we have to do more physical exercise, brisk walking, and not to have sedentary lifestyle.
Okay, sir. And so can men be affected by the human papilloma virus
Yes,
infection?
definitely. Because but for them the outcome is different. In general, most commonly we can get the anogenital wart, that
Okay.
is called anogenital wart, and also sometimes anal CA and oropharyngeal CA according to their sexual practices.
Okay, so can you explain the terms that you just said, anogenital warts
Anogenital
and...
wart means anal CA and anogenital in the anus region. They
Okay.
can have warts,
Okay.
okay, and cancer in the oropharyngeal region also.
All right. So is it related to cervical cancer? Like, how do they acquire the virus?
It can transmit from one to another.
Okay.
So male to female in any kind of sexual route.
Okay.
The most commonly HPV 16 and HPV 18 is the causative factor for cervical cancer in female, and there are other subtypes also which can cause the problems in men.
Okay, so coming to the last question,
Okay.
what would, like, are there any dietary choices that people can follow in order to reduce the risk of having
Yeah,
cervical
as I
cancer?
said, your own immunity is a very important thing.
Hmm.
So I always, firstly, I would also mention another point, that is precaution.
Hmm.
What is the precaution other than the sexual precaution?
Hmm.
That is also the preventive tests
Hmm.
and vaccines.
Okay.
That I should also mention to
Right.
complete the topic.
Hmm.
Uh, in any woman after 21, it is advised to take the pap paniculus test or
Okay.
pap smear test, which is done in the gynae outdoor
Hmm.
and reported by the pathologist. Pap smear is the test which can very early stage detect the cancer.
Okay.
So it is very helpful for women because they can still have pregnancy after treatment
Oh.
if it is detected early. This is one thing, and another thing is the vaccination that was we have already said about HPV 16 and 18.
Hmm.
The vaccination is now worldwide for women, and it can definitely help to lessen the amount of cervical cancer. So usually before the sexual practices come into play in women's life, so 9 to 14 age is a very important age for the earlier dose.
Okay.
Usually in one or two dose,
Hmm.
or and also in the menstruating age also people can have, but it is very important to have the first dose before the sexual practices start in any woman.
Okay.
And as per your question, the dietary habits,
Right.
it is important to focus on, in like in any other viral diseases,
Hmm.
how to improve your immunity.
Hmm.
So you have to take more antioxidants, fruits and vegetables full of antioxidants, and you can take vitamin C, vitamin E,
Hmm.
which are the two main most important antioxidants.
Okay.
So this is the main thing. Dietary is not much very different from others, just like COVID or any other viral infection.
Right.
How you improved your immunity, that is what the main thing.
Okay, sir. Sir, also, can you put focus on the hygiene
Yes,
related to
yes,
this?
very important. Hygiene is very important. Vaginal wash and
Hmm.
using regularly, that is very important.
Hmm.
And to use pads properly
Hmm.
and to change them whenever needed. That everything is very important because that is also accounting to the amount of internal immunity.
Hmm. Right. Thank you so much, sir.
Yes,
With
welcome.
that, we come to the end of the session. Please stay tuned to this channel for more such health and well-being related updates.